It's the first time that we've been able to describe information from our open label study of pre-exposure prophylaxis in men who have sex with men. As I think people are aware, pre-exposure prophylaxis is known to be safe and effective for preventing HIV acquisition in sexually active adults, including men who have sex with men and heterosexual men and women. The efficacy is high when PrEP is used consistently. And it was a very safe intervention. We were impressed how these drugs, even over a long-term period of time, had very few side effects, and the side effects that they did have were easily managed. But yet, PrEP is not flying off the shelf. We are finding that demand for PrEP services and people interested in providing PrEP to their clients remains relatively low. We think that part of this is just that it takes time for people to get their heads around new ideas. But part of it is that we really do need to learn more about how best to provide PrEP, how best to promote its effective use, how best to inform people's decisions about whether or not to use it. And to provide information that could help guide these efforts, we've done the open label extension of the iPrEx study. The iPrEx study was one of the studies that proved that PrEP was safe and effective. At the latest phase of the study, we offered PrEP to all of the participants. And so we offered pre-exposure prophylaxis to 1,451 men who have sex with men and trans women. They were located in Thailand, South Africa, Brazil, Peru, Ecuador, and the United States. They were relatively young, having an average age of in the mid-20s. And we were impressed that 72% of those people who were offered PrEP wanted to try it. And of those who wanted to try it, we found detectable drug in 72%. So the majority now who are attempting PrEP are able to succeed. This is a marked contrast to our previous experience in the placebo-controlled trials where in some sites, only the minority were taking the pill. And we've always thought that part of the problem with adherence in placebo-controlled trials is the placebo. Especially young people are wondering, why should they take a pill a day that might be a placebo? And so now that we're offering the real thing and real information about how well it can work when taken, we are finding that the majority of people who attempt PrEP can have effective levels of drug. And the level and the proportion using it effectively reaches very high levels, like 90% in places where, in some places like the United States and Brazil and Thailand and South Africa. So we think this is all encouraging. As we move forward, we're finding synergies between PrEP and other prevention strategies. PrEP is motivating and giving opportunities for HIV testing that would not otherwise occur. We're finding that people at highest risk for acquiring HIV are the most interested in PrEP services, and so they're coming out to be identified and engaging in prevention services, which of course include everything, condoms, STI management, everything. We also find that people who are taking PrEP are more readily retained in prevention services and care. So there's an abundance of synergies between our different efforts to stop the spread of HIV. People sometimes dwell on the possible antagonisms between one intervention and another, and in the case of prevention, we mainly see the opposite. We see synergies. Everything we do leads to people being interested in doing other things as well. So this is the first information to become available from a demonstration project of PrEP that is open label, and we're excited to be sharing it with people today.